So imagine it's like 2 o'clock in the morning in this incredibly crowded emergency room.
Oh, a super high-stress environment.
Exactly, just total chaos. A patient is crashing,
Yeah.
and the attending physician turns to the terminal, to order a life-saving medication.
Right.
But the system, it completely refuses to let them click submit.
Because of some arbitrary field.
Yeah, because some completely arbitrary mandatory billing code is missing from like a drop-down menu.
Wow.
And in that terrifying high-stakes second, you realize that modern healthcare isn't just about medicine anymore. It is inextricably linked to software.
Oh, it really is. It's the ultimate bottleneck, actually.
Right.
Because we always picture hospitals as these deeply biological environments, nurses taking vitals, surgeons in the OR.
Yeah, lots of human effort.
Exactly. But running parallel to all that human effort is this invisible, incredibly rigid digital nervous system.
I mean, trying to force those two worlds to cooperate has to be so hard.
It is arguably one of the most complex operational challenges on the planet right now.
Which is exactly why we are pulling apart this topic for you today. We've gathered this truly fascinating stack of material.
Oh, we have so much good stuff here.
Yeah, Tech Academy career guides, global salary reports, fresh market research, and industry surveys.
It's a huge data set.
It is. And our mission in this deep dive is to explore the people who actually solve this exact problem. We're looking at the highly specialized, surprisingly lucrative world of the healthcare business analyst.
Or the healthcare BA, as they're usually called.
Right, the healthcare BA. We want to understand how they bridge this massive gap between clinical needs and IT systems. What their actual daily battlefield looks like,
Right.
and how someone builds a career here.
And honestly, to truly grasp the value of this role, you have to look at the sheer economic gravity of the sector they operate in.
Tell me about it, because the numbers in these sources are wild.
The scale is almost difficult to comprehend until you look at the raw data. I mean, the U.S. healthcare economy is currently a $5.3 trillion sector.
Trillion, with a T.
With a T. That represents 18% of the entire gross domestic product.
That is massive.
Right. But the metric that really matters for anyone looking at career viability, what you really want to look at is the structural growth.
Oh, the Bureau of Labor Statistics projections.
Exactly. For the next decade, they show something remarkable. Look at a massive traditional sector like retail.
Right, everybody knows retail.
Well, retail is actually facing a projected 1.2% decline in employment.
Wow, okay.
But healthcare, on the other hand, is projecting an 8.4% job growth.
So it's just expanding rapidly while other sectors are actually shrinking?
Yeah, totally expanding.
So you have this rapidly expanding multi-trillion-dollar universe.
Yeah.
And sitting right at the critical juncture of it all is the healthcare business analyst.
Right in the middle hit.
Yeah, and reading through our sources, the best analogy I could come up with for their core function, it's like an elite bilingual interpreter at the United Nations.
Oh, I like that analogy.
Right. But instead of translating between, say, French and English diplomats, the healthcare BA is tasked with translating between doctor and software developer.
Yeah, which are completely different languages.
Exactly. And to make it even more stressful, they have to do this while appeasing a very strict compliance officer who's just watching their every single move.
That is a great way to picture the dynamic. But I'd actually add a layer of intense risk to that analogy, too.
Oh, really? How so?
Well, think about it. If a regular UN interpreter gets a phrase slightly wrong, maybe there's a diplomatic misunderstanding.
Right, an awkward moment.
Yeah, an awkward moment. But if a healthcare BA mistranslates a requirement, the hospital might violate federal privacy laws.
Oh, wow.
Or even worse, they could compromise patient safety. This is fundamentally why it isn't just a generic IT job.
Right, the stakes are literal life and death.
Exactly. The BA is forced to balance a completely contradictory set of stakeholder priorities every single day.
Let's actually look at those stakeholders. Because when you map out who is in the room, it sounds like a recipe for constant conflict.
Oh, it is totally a recipe for conflict.
On one side, you have the clinical staff, right?
Mm-hmm.
The doctors, the triage nurses, the pharmacists.
Yeah.
And their demand is entirely based on speed and ease of use.
Mm.
I mean, they want fewer clicks. They don't want to fight a user interface while someone is literally bleeding.
No, of course not. But then you look at the IT development teams who are actually building or, configuring the system.
Right, the coders.
Yeah.
Yeah.
They don't operate on ease of use. They operate on technical clarity.
Because a computer needs logic.
Exactly. They need exact logical parameters,
Yeah.
strict data types, and definitive rules to actually write their code. I mean, a developer can't program a feeling.
Right. They can't program make it easy for the nurse.
Nope. And standing right next to them is the compliance officer.
Oh, the compliance officer.
Yeah, and they are completely indifferent to both the clicks and the code. Their sole focus is regulatory coverage.
Does this specific screen workflow strictly adhere to HIPAA data privacy laws, that kind of thing?
Exactly. Does it meet the federal mandates for how patient data is stored?
And then hovering above all of them is the finance department,
Always the finance department.
just glaring at the bottom line, demanding to know the return on investment for the millions of dollars they just spent on the software.
Yeah, it's intense. So the BA is the one individual standing in the center of that room, absorbing all four of those completely different languages and synthesizing them into a single set of instructions.
And that synthesis, that's really the heart of the job, isn't it?
It really is. And it becomes incredibly visible during major software rollouts, which our sources refer to as EHR implementations.
Right. EHR stands for Electronic Health Record Systems.
Yep.
These are basically those colossal software platforms that function as the operating system for a modern hospital.
Yeah. The heavyweights in this space are vendors like Epic, Cerner, and MedTech.
Okay, so if a single misconfigured drop-down menu can stop a doctor from ordering a drug, what does the BA's daily routine actually look like to prevent that?
Well, a huge part of it.
Because the career guides talk heavily about mapping as-is to be workflows. For someone totally new to this, how does that actually play out on the hospital floor?
Let's look at a really tangible, everyday scenario to explain the mechanism here.
Okay, lay it on me.
Imagine a patient comes into the ER and needs an urgent MRI. Currently, let's say the ER scheduling system doesn't digitally communicate with the radiology department at all.
Wait, really? No digital communication?
It happens. So the as-is workflow, the physical reality of what happens today, is that a charge nurse literally writes the patient's ID and urgency level on a yellow sticky note.
Oh my gosh.
Yeah, and hands it to an orderly, and that orderly runs down 2 flights of stairs to physically hand it to the MRI technician.
Which is absolutely terrifying, considering it's a hospital in the 21st century.
I know, but it happens way more often than you'd think. So the BA's very first job is to document that entire sticky note process.
So they're just watching the orderly run down the stairs.
Literally, yes. They record the orderly's walking time, the specific information written on the note, and crucially, the massive compliance risk if that orderly happens to drop the note in a public stairwell.
Right, because that's a high-pay violation sitting on a step.
Exactly. So that is the as-is state. Then the BA has to design the to-be process.
The blueprint for the future.
Yes. This is the blueprint for how that exact same MRI order will happen once the new Epic or Cerner software is actually turned on.
Okay.
They have to figure out how an alert will fire instantly from the ER dashboard directly into the radiology queue, completely eliminating the orderly and the sticky note.
Got it. So they are conducting what the guides call a gap analysis.
Exactly.
They are finding the operational hole between the messy way we do things today and the streamlined way the software wants us to do things tomorrow.
Yes, exactly. And once they identify that gap, they have to write it down in a very specific format. It's called a business requirements document, or BRD.
BRD, okay.
The BRD is basically the formal contractual blueprint that tells the IT team, here's exactly how you must configure the software to close this gap.
Right.
And after the IT team builds it, the BA moves into the next phase, which is user acceptance testing, or UAT.
And this is where they actually prove the system works before letting it touch real patients, right?
Right, exactly. During UAT, the BA brings that exact same ER charge nurse into a room with a laptop.
Okay.
They load up a fake, dummy patient in the system and say, okay, try to order an MRI for this patient.
Does the digital alert actually reach radiology?
Right. Does it reach radiology? Does the screen layout actually make sense to you? If the nurse gets confused by the screen, the BA has to take those notes back to the developers and refine it all over again.
Okay, I have to stop you right here and push back on something.
Sure.
Because there's something that seems like a massive contradiction in the sources. What's that? If a hospital network is spending tens of millions of dollars to buy a world-class system from Epic or Cerner, doesn't the software vendor just set it up for them?
Ah.
I mean, Epic knows how Epic works better than anyone. Why on earth does the hospital need to hire their own internal business analyst to sit in the middle?
It's a really common assumption, but it completely ignores the physical reality of healthcare.
Really?
Yeah, Epic absolutely knows how their software works out of the box, but Epic does not know how your specific hospital operates.
Oh, I see.
Every single healthcare facility has entirely unique clinical workflows. They have completely different physical floor plans. I mean, the layout of an ER in a small rural clinic is entirely different from a massive urban trauma center.
Right, that makes sense.
They have different nurse-to-patient staffing ratios. They operate under unique state-level regulatory and billing requirements that don't apply one state over.
So you really can't just buy healthcare software, install it, and expect it to run your hospital right out of the box. It's not plug and play at all.
Not at all. Think of the software vendor as providing this incredibly sophisticated, highly complex block of clay.
Okay, clay.
The internal business analyst is the one who ensures that clay is actually sculpted to match the physical and regulatory reality of that specific hospital.
Wow.
And there's another massive layer of complexity here, too. Interoperability.
Oh, right, interoperability.
Yeah, your new Epic system doesn't just exist in a vacuum. It has to talk to the legacy billing software, the specialized laboratory machines, the external pharmacies down the street.
Right, our sources mention these interoperability standards. Acronyms like HL7 and FHIR.
Yes, Health Level 7 and fast healthcare interoperability resources.
So if I'm understanding the mechanism here, these standards are basically the universal USB ports of healthcare data.
That's a great way to think of it.
Right. They are the standardized formats that allow a hospital's primary software to plug into and securely communicate with a completely different company's software.
That is an excellent way to conceptualize it. It's a universal USB port, but one that's wrapped in layers and layers of federal security and privacy mandates.
Right, because if you see.
Exactly. If the BA doesn't map those connections perfectly, the lab results don't make it back to the patient's chart, and the whole system just fails.
Man. With the stakes being that high and the complexity being that dense, it really makes you wonder how hospitals ever trust anyone to do this job.
It's definitely not for everyone.
You clearly can't just walk in off the street or even transfer over from a retail IT department and start mapping HL7 interoperability requirements.
Absolutely not.
So how does someone actually build a career here? Let's trace the roadmap for the listener from a complete beginner to a highly paid domain expert.
Well, the progression is highly structured precisely because the learning curve is so steep.
Okay.
At the entry level, which is generally 0 to 2 years of experience, you see titles like Junior BA or BA Trainee.
And what are they doing?
Their reality is executing foundational tasks under heavy supervision. They aren't the ones leading the interviews with the chief medical officer, obviously.
Right, they're not quite there yet.
Instead, they're sitting in the corner taking meticulous notes, helping draft pieces of that business requirements document, and supporting that user acceptance testing process we just discussed.
So they're learning the ropes. Do they need a medical background?
They do not need a medical degree to start, but they are expected to be aggressive learners of the healthcare domain right from day one.
Which makes total sense.
Yeah.
I mean, you don't have to be a nurse, but you absolutely have to understand the logic of how a nurse goes about their shift.
Exactly.
So where do they go once they hit that, say, 3 to 5 year mark?
That's the mid-level phase, and it's where a BA becomes truly independent.
Okay.
They are now conducting their own requirements, elicitation, meaning they are actively running those workshops to extract information from the stakeholders.
So they're running the meetings.
Yes, and they manage their own work streams. A significant milestone at this stage is obtaining formal certification, most notably the CCBA.
Right, the Certification of Capability in Business Analysis.
Yes. Earning the CCBA is basically the industry's way of verifying that, the formal, standardized vocabulary and methodology of business analysis.
It proves you aren't just completely winging it.
Exactly. It proves you have the skills.
So that solidifies your methodology. What happens when you cross into the 5 to 10 year range? The senior status.
At the senior level, the scope of responsibility expands dramatically. You are no longer just mapping a single workflow like an MRI order.
What are you doing then?
You are owning the end-to-end requirements for massive, multi-year integration programs across entire hospital network.
Wow, it's huge.
It is. You are managing delicate, high-level client relationships. Senior BAs often pursue the CBAP, the Certified Business Analysis Professional designation.
Which our sources say is the gold standard for senior practitioners.
It really is. But the real shift at this level is deep specialization.
Right, the sources emphasize this heavily. They stop being a general healthcare BA.
Correct. They become a subdomain expert.
Like what?
Well, they might become a revenue cycle BA, entirely focused on the labyrinth of insurance codes and Medicare billing.
Oh, fun.
Yeah, or they become a clinical workflows BA, specializing only in patient care processes. This specialization sets them up for the top of the mountain, the principal or subject matter expert level.
Which is 10+ years of experience, the healthcare domain, SME.
Exactly. At this tier, they're providing strategic advisory services to hospital executives. They drive business development for consulting firms,
Right.
and they hold the most respected, highly specialized healthcare IT certifications available. We're talking about the CPMs.
The Certified Professional in Healthcare Information and Management System.
Yes, and the CHDA, the Certified Health Data Analyst. These credentials signal absolute mastery of the intersection between healthcare data and technology.
What stands out to me looking at this roadmap is how unique the progression is compared to almost any other corporate job.
How do you mean?
It is explicitly a dual-track progression. You aren't just leveling up your IT methodology like learning better ways to write a requirements document or run a testing cycle.
Right.
At the exact same time, you are forced to level up your understanding of the healthcare business ecosystem. You are literally climbing two ladders simultaneously.
And that dual-track effort is the core mechanism behind their immense value.
It creates a moat, doesn't it?
A massive moat. Mastering the domain knowledge, truly understanding how Medicare regulations impact billing, or how a specific clinical pathway operates on the floor, it creates this incredibly protective moat around your career.
Right.
A brilliantly talented IT business analyst who has spent 10 years in the retail or banking sector cannot simply walk into a hospital and start designing a patient portal.
Because they just don't know the language.
The domain is too specialized, it's too heavily regulated, and frankly, it's just too dangerous for a tourist.
Building a protective moat that deep has to come with a serious financial payoff. Let's actually look at the compensation data from our sources for 2025 and 2026.
Let's do it.
Because mastering both software architecture and hospital operations should definitely command a premium.
Oh, the global baseline numbers definitely reflect the difficulty of acquiring those skills. In the U.S., the average salary for a healthcare BA sits at a very lucrative $100,749 a year.
That's a great baseline.
Looking internationally, the UK averages $36,331. Canada comes in at CA, $57,139, and Australia sits at A, $113,729.
And what about India?
In India, the average is 8.2 lakhs per year.
But the data makes it clear that you can't just look at the national averages, right? I mean, the mechanisms driving these salaries are heavily influenced by specific regional economies and the structure of global outsourcing.
Very much so. Within the U.S., for instance, if you look at the Pacific region states like California, Hawaii, Washington, and Oregon.
Expensive states.
Yeah, the average jumps significantly to $127,170. That mechanism is straightforward, though. You have massive, highly funded hospital networks operating in some of the most expensive cost of living economies in the world.
Makes sense.
But the dynamic in India is perhaps the most fascinating example of how domain knowledge drives value.
Oh, you're talking about the Bengaluru data.
Yes. In India, a city like Bengaluru commands a 15 to 20% premium over the national average, bringing salaries up to 9.5 to 11 lakhs.
And the reason for this is entirely strategic, right?
Completely. Bengaluru has established itself as a massive global hub for U.S. healthcare IT outsourcing. Major consulting and tech firms like TCS, Cognizant, and Infosys run massive healthcare practices out of the city.
So even though they are located in India, they're being paid a massive premium because they possess highly specialized knowledge of the U.S. healthcare system's compliance and billing rules.
Exactly.
They understand the nuances of IPAY and HL7 from literally half a world away.
Yeah, the domain knowledge transcends the geography, but honestly, if you want to look at the absolute biggest lever for multiplying your salary,
What is it?
it comes down to vendor certification.
Oh, this part of the research genuinely shocked me. We established earlier how difficult these massive EHR systems like Epic and Cerner are to implement.
Right.
It turns out simply proving you know how to configure them is basically a golden ticket.
It really is the ultimate supply and demand scenario. The data indicates that holding an Epic or Cerner vendor certification can add an immediate 20 to 30% salary premium to your compensation.
Or 30%.
Yep. This is especially true for those India-based roles serving U.S. clients, but it applies globally. And if you add a broader industry credential, like the CPH as we discussed earlier, that adds another 10 to 15% on top of your baseline.
A 30% jump just for holding a vendor-specific certification. That is totally wild.
It is crazy.
Like the equivalent of getting a master's degree. But your expertise is entirely focused on a single piece of proprietary software.
Well, to understand why the premium is so high, you really have to look at how these companies control their ecosystems.
Okay, what do you mean?
You cannot just go online, watch some free tutorials, and get certified in Epic. It is a completely closed ecosystem.
You can't just take a course on Udemy.
No, absolutely not. You generally have to be sponsored by a hospital or a consulting firm that already uses the software just to access the training materials and take the exams.
Oh, wow. That creates a huge barrier to entry.
Exactly. It creates
Yeah.
an intense artificial scarcity. The hospitals absolutely must have the software to survive, right?
Right.
And the federal regulations mandate strict compliance. But the pool of certified professionals who actually possess the keys to configure it is kept remarkably small.
Man, it's the perfect storm for driving up compensation.
It really is.
Now, before we wrap up our analysis of the financial landscape, we do need to ensure we cover all the metrics provided in our industry sources.
Of course.
The HIN Salary Survey specifically highlighted vital data regarding the gender pay gap in healthcare IT. And we should impartially report this for our listeners to have a completely accurate picture of the market.
Yes, the latest data from the HIMSS survey indicates a significant disparity. Across healthcare IT, women make 79.8% of what men do for similar roles.
Okay.
When they calculated the averages across all IT positions in the sector, the average female salary was reported at $100,762, while the average for men sat at $126,262.
You know, it is a critical industry metric for anyone navigating this space. If you are entering this field, understanding exactly what the baselines and gaps are is just essential for charting your career path.
And advocating for yourself at the negotiating table.
Absolutely.
Because navigating your career requires the same level of analytical rigor that a BA applies to a hospital workflow. You really have to understand the complete landscape.
Right.
The premiums driven by geography, the immense multipliers created by artificial scarcity and certifications, and the baseline demographic realities.
So let's take a breath and recap the incredible journey we've just been on.
It's been a lot.
It has. We started by looking at the staggering scale of the $5.3 trillion U.S. healthcare economy.
Cute.
We unpacked how business analysts serve as the ultimate bilingual interpreters, translating between the high-speed needs of clinical staff and the rigid, logical realities of IT developers.
All while keeping the compliance officers at bay.
Exactly. We walked through the daily battlefield of EHR implementations, exploring how a BA bridges the gap from a chaotic sticky note as-is reality to a streamlined HL7 connected to be future.
We covered the roadmap, too.
Right, tracing that highly protective dual-track career progression from a junior note taker all the way up to a strategic domain SME.
And the finances.
Yep, finally exploring the mechanisms behind the compensation, showing how geographic outsourcing hubs and closed ecosystem certifications act as massive salary multipliers.
It is a profession that demands an extraordinary combination of skills.
I'll say.
You need the technical aptitude to understand data structures, the communication skills to manage frustrated stakeholders, and the relentless curiosity to master a continually shifting regulatory landscape.
It's definitely not a job where you can just clock in and coast.
No, but for those who can navigate it, the reward is a career that is highly resilient, financially lucrative, and deeply impactful on human lives.
Which brings us full circle right back to the physical reality of healthcare.
Yeah, and actually, I want to leave you with a final thought to mull over.
Oh, please do.
The next time you find yourself visiting a hospital, or even just sitting in your local doctor's office, take a moment to look away from the medical equipment.
Okay.
Pay attention to the screens. Watch the precise digital steps the triage nurse takes when they admit you. Notice how the front desk staff processes your insurance information through their portal.
It's all part of that invisible nervous system.
Exactly. When you are sitting in that waiting room, ask yourself, how much of your actual physical experience as a patient in that very moment was designed not by your doctor, but by a business analyst meticulously mapping that exact workflow months or even years prior?
Wow. That is a wild thing to realize. You aren't just experiencing medicine, you are experiencing a translated business requirement.
Exactly.
Well, thanks for joining us on this deep dive. Keep questioning the systems around you.